All right, so I know we're a little bit past time, so I'm going to go ahead and get started with our welcome introduction so we can jump into the panel. Hi everyone, David Surratt, he, him pronouns. I'm Vice President for Student Affairs and Dean of Students at OU. So welcome to our Student Affairs colleagues and also any stakeholders or partners or guests that may be viewing or be with us today. Today we've got roughly a little less than an hour to have some discussion around the importance of understanding public health and mental health, and also any helpful information as we think about pandemic recovery. And I'll talk about why that's important in a moment. This session will be recorded, so there'll be an opportunity for us to share the recording of the video with our leadership team and share with others as appropriate or as they see fit. So we'll have that opportunity as well. So I want to jump into why this panel and why it's important. As you have seen and probably have already read, the phase 4 announcement around the return to campus planning between now and August was sent out from the president's office and to the rest of the university. And one of the things that I think is important is this is a good sign. And while we are pleased about it, there also may be prevailing questions or concerns. And so our responsibility is to understand and try to continue to communicate. So when we think about the idea of understanding our own stress or trauma as we recover from the pandemic, we're also talking about ways to empower our own resilience, which requires empathy and also communication from many stakeholders. I know many of you have already been in conversation with your supervisors and managers and with your staffs. And I know there's lots of conversation about individual reactions and responses to the idea of recovering from a pandemic and a public health crisis. And while there's much to be celebrated, again, I think that's important for us to also be thinking about any prevailing questions you may have and ways to make you feel and continue to feel more confident as we continue to move forward through the summer until we get to August with a fully repopulated campus and the idea of many of us who may have been telecommuting are returning to our physical workspaces, or for those of you who never left campus, managing the change in the climate and culture when we repopulate the campus with a full faculty, staff, and students coming back for in-person instruction and services. So I had some special guests join me today, and I'm going to ask them to introduce themselves in a moment, who are tremendous experts and trusted people who have great information and great wisdom to share with you all about the questions related to public health, mental health, and the impacts on us as individuals. Before I introduce them, I wanted to share just a quick anecdote and story to even put this into really a simple way that I've been looking at the pandemic recovery process. When I was a teenager, I was riding in a car with my dad. He was driving, and of course, I grew up in Tulsa, so I had my Quick Trip slushie. That was a requisite to have. So we're riding in our car. I've got my slushie from QT, and I remember us being at a stoplight and at a full stop. And all of a sudden, there was a moment where I heard this very loud screeching of tires for a long time. And then all of a sudden, a jolt. And I remember I was pushed forward and knocked my head against the windshield and realized we just got into a car accident and we had been rear-ended. In that moment, there was a number of kind of feelings I had, but funny enough, as a teenager, the biggest feeling I had was the fact that I had spilled all my slushie all over the windshield and all over the windows in my lap. And in that moment, I just think, I was like, what just happened? I don't know what's going on. My dad, on the other hand, wanted to make sure that the cherry slushie was not anything that was supposed to be inside of me. So he's inspecting me and he's scared and worried, of course, about his concern for me. And I'm just kind of like numb for a second and confused and hoping I get a slushie later on the day, right? But going on to this idea of days later, weeks later, I started feeling this sense of fear and panic every time I heard any squeal of a tire. This happened probably for months. And this was at a time when I was trying to learn how to drive. And I didn't think I recognized what that was for me in terms of trauma and a trauma response at the time of being hyper vigilant, hyper conscious, and hyper aware when I heard squealing tires. And so I wanted to kind of paint this quick picture of a car accident, only because oftentimes every individual has their individual reaction and response to a major incident or crisis that occurs with them. My dad, I don't know what he was going through, but I imagine it was probably troublesome for him to have to deal with car repairs, the insurance, contacting police. I wondered if he was angry with the driver immediately because he was scared of how the impact might be on me. I don't know. And there's sometimes I know when I've been in accidents now, I have more of a sense of how I respond. I oftentimes think of ways to find controls, to think about what are the steps in terms of safety, check on individuals, check my insurance, call police, etc. But the varying responses there that happen are individual responses, oftentimes to the idea of trauma. And so that's why I really thought it was important for us to continue our conversations today. And I hope that a big part of this is to allow you to answer questions, fill some gaps, and also think holistically about our response to our recovery process, and hope that we can get to a point in which we can thrive post-pandemic. So during our talk today, we'll have some panel discussion with our guests, and then there'll be also a period of time where we're going to have some Q&A. You'll be able to submit your questions in the Q&A function in the chat below. So be thinking about your questions, and I'll be sure to prompt you later on in our conversation and discussion. So again, thank you all for being here today, and I'm going to kick in our introductions now with our special guest. So Dale, would you like to go ahead and introduce yourself and share your name and your time here, your title, and what you do at OU?
Yeah, thank you, David. Really a pleasure to be here today. I'm Dr. Dale Bratzler. I have several roles at the University of Oklahoma. I'm currently the Chief Quality Officer for OU Health. So that puts me over quality responsibilities for our hospital system and our ambulatory practice. But about a year ago, President Harris asked me to take on the role of Chief COVID Officer for the university, which has consumed a lot of my time over the past year, but allowed me to get to work with so many great people across this entire university. Tomorrow is my 10-year anniversary with the university, tomorrow.
Awesome. Thank you, Dale. And Scott.
Yeah, I think I know just about everybody on this call. I'm Scott Miller. I'm the director of the Counseling Center, and then I also manage a number of our crisis response teams on the Norman campus. I can tell you, I greatly look forward to getting back together with everybody. I think next week will be an event, and then we have a big student affairs event following that. I realized how much I missed everybody when I got to volunteer at the big vaccine event that happened in the Armory. For some reason, I had an energy being around people again. And I think for me, that's when I realized how much I missed human contact with people. So I've been here about 20 years. Always happy to consult with folks if they're needing some mental health support. And my only role here is to just talk about the mental health aspects of what's happened to us.
Great. Thank you, Drs. Miller and Bratzler. Appreciate you being here with us today. Let's jump into some of our questions that I wanted to share and kind of start a conversation, and hope it'll inspire some additional questions from our audience members too. And our audience members, as you're thinking about questions that you may have, I'd also love for you to be thinking about questions you may have also heard from others that could be helpful to hear responses to as well. So I'll start with Dale. When we think about where we're at in terms of Oklahoma, when you think about our public health, can you share a little bit about COVID infection rates in Oklahoma and how we might compare with other states when it comes to their rates as well?
Yeah, so the good news is the number of cases of COVID-19 in Oklahoma is way down. So as of this morning, we're seeing about 3 cases per 100,000 population per day in the state. And just to put that in perspective, in January, we were at 103 new cases per 100,000 population per day. So this enormous drop in the total number of cases. Oklahoma currently ranks 38th in the nation, but I will just tell you that all of the states are clustered up at very low rates now because nationwide the rates are down. Just to give you some other states for comparison, Wyoming's at 13 cases per 100,000 per day. Missouri's at 8 cases per 100,000 per day. Again, Oklahoma's at 3. Some other good news, Cleveland County is down to 1 new case per 100,000 population per day. And the city of Norman is only seeing about 2 cases per day on average right now. Just one more thing to put all of this in perspective is the health department suggests that there are somewhere around just under 1,000 people in the state who are actively infected with COVID-19. I'm going to assume that there are people who are actively infected who haven't taken a vaccine and but never got a test done. So let's say there are 4 infected people for every 1 that actually went and got a test done. So there would be somewhere around 5,000 people in the state that are infected. In a state of 4 million people, assuming people are evenly distributed, in a group of 1,000 people, 1 person might be infected. So the incidence rate is way down, and your opportunity to run into somebody who's infected is also dramatically lower.
That's helpful, and it's really great to hear, especially how we compared to other states, but also even our local and county. One thing that I know I have heard about is the various strains of the virus. Maybe, is there anything helpful you might share about the different strains that have been talked about that have been transmitted?
Yeah, so I'll talk about, they just changed the nomenclature for strains. So we talk about Alpha and Delta are the primary strains we're going to talk about. Alpha is the UK variant, which is the predominant variant that is now in Oklahoma, but we've seen 30 cases of the Delta variant, the India variant of the virus in Oklahoma, and it is a bit of concern. I'm doing a press conference a little bit later today, and I'll talk about the Delta variant, but it's more transmissible, and it has taken over in the UK for the UK variant. So it is one of concern that we have to watch for. There have been outbreaks of the Delta variant in Cleveland County, and the vaccines, though they're very helpful, about 88% effectiveness against the Delta variant, not quite as good as the original strain of the virus.
And that's a perfect segue into the next question I had about vaccinations, right? So when you think about our vaccines, can you talk about their level of safety, and is it something that you recommend not only for adults but also for children? Is it safe for them?
Yeah, absolutely. So I think a couple of points to make. The RNA vaccines that everybody's had some concern about. The development of those vaccines started in the 1990s. I work with a friend at the NIH, and they've been studying RNA vaccines for influenza, Zika, Ebola for years, and have never seen any long-term serious side effects. We've given nearly 300 million doses of the Pfizer and Moderna vaccine in the United States. And so we've just seen almost no serious long-term side effects of anything that we've been able to tie actually directly to vaccine. When you give 300 million doses of vaccine, people are going to have events that they would have had anyway. And so looking at causes, though, attribution, the vaccines appear to be very, very safe. The Johnson & Johnson vaccine did have the association with the blood clots, but another thing I'm going to highlight in the press briefing a bit later today is that if you get COVID, you're about 7 times more likely to get those blood clots than you are from getting a vaccine. So again, the vaccines are safe. You don't want to get COVID, and you certainly don't want to be hospitalized with COVID.
Absolutely. Thank you for that. I did not know about that, actually, in terms of the risk of blood clots. And the one thing too that I thought was really helpful is I've heard about the vaccine's effectiveness with preventing major illness with the Delta strain or even hospitalization. Is that correct?
Yeah, absolutely. So in Oklahoma, again, we had the initial 17 cases of the Delta strain that happened in Oklahoma. 5 of the people had been vaccinated, 3 fully vaccinated, 2 had only had 1 dose. Again, the vaccine is not as effective against the Delta virus. But interestingly, none of them ended up in a hospital. We see the same thing with the influenza vaccine every year. A lot of people take the vaccine, and some people still get the flu, but they don't end up in the hospital. They don't end up in our ICUs. So even partial immunity will substantially reduce the seriousness of the infection.
Great. Thank you for that. So I wanted to turn to Scott and ask you a little bit about, as we are hearing information and we're thinking about I guess the world proverbially opening up more. I've heard this notion of anxiety or COVID anxiety related to that happening, right? I just got done reading a tweet this morning about San Francisco's from their mayor talking about their low infection rates and them opening up. And so when you think about this idea of anxiety related to COVID that comes up, can you share what might be happening for people as more businesses or travel or more activity is happening for people and we're opening up?
Yeah, I think what we're going to find is that everybody is going to react differently to opening up. I think one thing that I think people are more aware of, one thing we've learned about emerging studies in psychology is we have to think about our reactions in terms of our wired temperament or how we were programmed to come into the world. And I think COVID has shown us that some of us are more cautious than other people. Some of us are less willing to take risks or more nervous to take risks. And those are the people that are going to be more nervous as things are opening up. One thing we know about temperament is some people are wired to naturally be more anxious than other people. The problem for those groups of people is then we go through our lives labeling that as bad or weak or something wrong with us. And so I think the biggest thing we all have to do is acknowledge that we're all going to be in different places with that and have empathy for ourselves about our reactions. And if we're nervous, we need to find ways for us to take risks. But having Dr. Bratzler on this is fantastic because he can help us learn what are educated, healthy risks as opposed to really unhealthy, not good risks. And I think for the anxious of us, we have to begin putting ourselves out there in ways where we feel like we have a little bit of control and be able to tolerate that anxiety without labeling it as bad. Just being aware that you're feeling anxious and not beating yourself up too much about it. As we were getting ready for this, I talked with David about it. I'm trying to put myself out there in new situations. For me, the ultimate danger place is Walmart. I have it in my head that anything bad happens at a Walmart in terms of human behavior. So I rolled out on a Saturday morning at 7 a.m. when it wasn't too busy without a mask, just to see what that felt like. And what I experienced was I could feel the air in my lungs in a way I never did before, just because I am so used to wearing a mask that not having a mask, I was aware I was having psychosomatic reactions to it that I was amused by. And I think if we can be amused by those reactions as opposed to freaked out by those reactions and realizing that's going to be our normal process of opening up again, I think we can roll with our anxiety better. If we are less risk averse, I think we have to be more patient with our family, friends, and children that may be more risk averse to make sure we're not forcing them to do something that's beyond their level of coping with it. So encourage them to do a little bit, but not throw them to the wolves and have them be so overwhelmed they can't cope. And I think the more we take risks and the more we realize we're okay, we're gonna be able to get through it. The other thing I think we have to do is orient towards the positive part of taking those risks, which are student affairs staff is the glue that makes the university go in terms of students' social experience at the university and their outside the classroom experiences. And we saw this last year when we stripped all of that away, our students suffered. So our students need us to be that social cohesion on campus that help them get connected and make meaning here and feel a part of things. So I think if we can orient towards the fun of being around each other, community, and the positives, it helps us tolerate the risks a little bit more, or the anxiety a little bit more. But we know anxiety and depression have skyrocketed. Even people that didn't experience anxiety and depression pre-COVID had some of it during COVID. And we will get through it, but it's going to take a little bit of time.
Oh, absolutely. Yeah, I remember us talking about that too. And I remember having that kind of that moment of salience too. I think the biggest one lately had been at our graduation ceremonies. I know we had purposely done a lot of our outdoor ceremonies, and there were graduates that I, including student workers in our office, that I jokingly said that was the longest I'd ever seen like the bottom half of your face. This entire year, you worked in my office all year long. And we just kind of had a good laugh at it. And it was a way to kind of acknowledge, yeah, it just felt different. It felt weird, and understand why that weirdness kind of came up. And speaking of the why, can you maybe talk about how trauma may play in some of our responses, right? You talked about the ways in which we are wired, and oftentimes that shows up in different ways in different spaces innately. But how might trauma impact the way we respond to the pandemic recovery process?
Yeah, I think we have to think about COVID as a worldwide traumatic experience. A way to think about it is we as human beings are programmed to be meaning makers and to believe we have more control over our lives than maybe we actually do. And COVID, for all of us, stripped away our sense of meaning and our purpose. And it also stripped away our understanding of what we could control, because we all of a sudden were locked in our houses. We couldn't go out and about. People that were once comfort were now danger. And I think we have to redo our sense of meaning and our sense of control. The other thing I think we have to be acutely aware of is that our trauma this past year has been layered. We've had the COVID trauma, but we've also had the racial and Black Lives Matter trauma. And for a lot of us, we've also had the political unrest. And all of that happened at the same period of time when we could only cope with so much. So our trauma isn't just COVID, it's all of it. But I think what we need to do is begin to make more meaning out of our lives and put that meaning back into our lives, and also realize that we do actually have some control over what we can and can't do now. We have more knowledge about the virus. Having ideas of incidents of rates of infection helps us make control and meaning. We can be out with each other again. And I think as we slowly get back into that, I think we'll begin to recover from it. But the biggest deal with trauma is to acknowledge that it's real and it's there and it has some symptoms that we have to pay attention to. Irritability is a piece of it. We may get frustrated or angry more quickly than we normally do. Sadness. There's a term that psychologists coined called malaise, which is you just don't have enjoyment or fun in some of the things you used to do. So I think if we can anticipate that things aren't naturally just going back to normal as soon as we get back to the office, that it's going to take us time to get back to normal, and have patience with ourselves through that, and figure out some coping skills that work for us, it's going to help us get through that.
Thank you, Scott. Yeah, I really appreciate you also mentioning the impacts, not only around the public health crisis, but also because of the public health crisis, how much that restricted other tools that people used to have a sense of agency in response to a number of things. And shout out to Goddard, actually, because I recall a great Instagram post when about this time last year, when there were marches in relation to the murder of George Floyd, there was a recognition that many felt like they could not do anything because of the public health crisis, and yet they were seeking information of ways to be safe or minimize risk. And so they had a great infographic saying, like, if you choose to march or if you choose to gather in groups, this is how you need to maintain safety in relation to COVID. And so thank you for that reminder as well. Speaking of the importance of information, I think about the ways in which ambiguity heightens our stress when it comes to our experiences with trauma. And I'd love to maybe punt this to Dale and talk about trusted resources. When you think about getting good public health information, what are some suggestions or ideas about making sure you're able to get access to good information to make sure I'm able to make reasonable decisions about public health and walking about?
Yeah, so I think it's real. There's been so much disinformation out this past year about the disease, the severity, the vaccines, and everything else, that it's made it difficult from a public health standpoint to keep people safe. I still rely on the CDC for a lot of information that comes out. I actually spent a year as a senior policy advisor with the Centers for Disease Control. They're scientists. They work really hard. They're based on science. I think they had too much political influence this past year, but the CDC, they have really good people. I think they're working really hard. Every day I get all the data that I collect from the Oklahoma State Health Department. I actually communicate with some of their data folks on a routine basis. They too are working really hard to make sure that the information is correct, credible. The team over at Goddard does a really nice job. Craig Rice, Will Wayne, Maggie, and others just do an amazing job of providing information. And then we update continuously the information that's on the internet for the university. And I encourage you to go there if you have questions, because we really are working to make sure that the information that's out there is credible. We change it, we update it. We've created dashboards and everything else we can possibly do to be as transparent as possible about what's happening at the university.
Thank you for that. Yeah, I do think that that's a key thing for us, is making sure we understand where the trusted resources are, both local and national resources, et cetera, and making sure we're able to do that. And honestly, that's been a big part of it. I know Dale and I have talked about this before. I've told him thanks many times, because a big part of this is not only understanding having trusted resources of information, but also how does that inform our operational decisions, but also personal decisions about our own risk and safety. And so I wanted to maybe kick in one last question about moving forward. What are some observations from, Dale? I'll start with you, Dale, first, but also Dale or Scott. Observations about OU and our kind of wider community response to the pandemic that gives you hope for us moving forward as we kind of continue through the summer and go into August with the expectation of being 100% in person.
Yeah, so first, I'm really looking forward to having full capacity again. I teach on the Norman campus, 3 different classes I participate in down there, and it just hasn't been the same. Trying to teach by Zoom, I think it's going to be a much better experience. So I look forward to it. I do think, I try to be the word of caution. I think we're going to see low rates of transmission of COVID-19 through the summer. It's probably a virus that acts like influenza and other diseases that tend to spread easier in winter months when it's cold and people congregate indoors. We know the virus spreads principally indoors, not outdoors. So I think we have to remain vigilant. Even on this campus, we've still had, on occasion, somebody get infected and then expose other people who are unvaccinated. So I'm looking forward to getting all the students back and finding student ambassadors and others to really help us promote vaccination, which is by far the most effective way that we can prevent spread of this disease going forward. And then we just have to remain vigilant. We have to watch, see what's happening. Our team meets routinely. If we see any changes in rates, outbreaks, clusters, we'll get that information out and change policy as we need to.
Mm-hmm. Great, thank you, Dale. Scott, did you have any comments about that?
Yeah, I think the other thing we have to keep in mind as student affairs professionals is our students are going to come back with trauma just like we were. I think it's a huge advantage that we're coming back first to get our feet wet, to get used to it, to get through that process, because we're going to have to think about supporting our students who are coming back, who also, a percentage of which are going to be those cautious folks who lived through a year of fear and lost a year of college. So I think we're going to have a year where we're going to have to really work to connect students to each other and build back community. So I think we need to keep in mind that we need to put ourselves in a good position to be ready to help our students, because we've had students that have lost a year and a quarter of college that they can never get back again. So I just think we need to make sure we're taking care of ourselves so that we can be there to serve them, because they're going to need a lot this next year. And as mental health professionals, we always pay attention to taking care of ourselves because we got to be there for others. And it's that same idea that we've got to exercise, eat well, sleep, talk with each other to build community with us so that we then are there and have the energy to serve the students, because that's what we're going to need to do in the fall, which will be energizing for us, but are going to be really hard if we're not in a good place. So I think we need to keep that transition in mind as well.
Yeah, that makes a lot of sense. And shout out to our Sarkees and Fit Rec folks. I know they've been promoting a lot of ways we can kickstart our focus on ourselves and our well-being throughout the summertime in preparation for the fall. So absolutely. So I want to, I see you, Amy. I want to kick it over to some of the questions we've now gotten from our attendees, and I want to jump in there. So the first question that we had, this is probably for Dale. What's the risk for a fully vaccinated individual attending football games with the stadium at full capacity and no mask required?
Yeah, so it's a great question, because I've had this conversation with Larry Knifey before. So remember early in this webinar, I highlighted that if you're around about 1,000 people, you might expect, at least based on current numbers, about one person to be infected in that crowd of 1,000 people. Get 80,000 people inside a Memorial Stadium, and we could see 80 people that are potentially infected in the stadium. The good news is, well, two pieces of good news. Number one, transmission outdoors is much less likely than it is indoors, though there is risk when you're tightly crowded. And I know it gets tightly crowded in Memorial Stadium. Secondly, CDC published data not long ago looking at what's called breakthrough infections. That's infections that occur in people who are fully vaccinated. And out of 101 million fully vaccinated people, they identified 10,000 cases, which is far below 1% risk of infection. I personally feel comfortable without a mask in most settings. I think, though, that, you know, as Scott has pointed out, there are going to be people that just aren't comfortable in that setting. They either won't come to the games, or I encourage them to wear a mask, because we know that masks are very, very effective at preventing both spreading the infection, but also getting the infection. So, you know, I always point out to people, please never shame anybody because they decide to wear a mask in a place where it's not required. You don't know their medical history, who the people are in their home, and others who may be at greater risk of the disease or complications. And they may have very good reasons, or just for those reasons that Scott highlighted, they're not ready to go there yet, and that's fine. I still wear a mask in a lot of settings. So I think the risk is going to be relatively low, particularly if you're vaccinated. That's why I keep highlighting. Full vaccination is the ticket to really dramatically reduce the rates of infection. If you don't know, Oklahoma's only at about 33% full vaccination rate right now.
Thank you for that response to that question. And thank you for the submission. So the next question we had here was, are there suggestions for keeping our families that are not at the age they can get vaccines safely? Are there suggestions for keeping safe our families that are not at the age they can get the vaccine?
Yeah, so that's a real difficult question right now. So first, the best way to protect them is to be fully vaccinated yourself. Because if mom and dad are fully vaccinated, then their risk of being infected by their child is incredibly low, and they're very unlikely to get infected and spread the infection to somebody else. That's been well demonstrated now, that full vaccination prevents both asymptomatic spread of the virus, and it also keeps you from getting infected. So that's the really good news. I personally think that schools, you know, in that age group that can't be vaccinated should still require a mask. But as we may talk about in a moment, there are some legislative restrictions on what we can do in Oklahoma now. So encourage your kids to wear a mask if they're not vaccinated, particularly in settings where they're indoors and around crowds of other people.
Yeah, absolutely. I've got a couple nieces and nephews who are not of age to be vaccinated, and so we are definitely a household that was trying to make sure we protected ourselves and protected them by getting vaccinated, and then thinking about being conscious, right, of where we go in different spaces, especially indoor spaces for sure. And then you touched on the next question that we did have here, is that we've seen Lots of other public institutions across the country require vaccination. Is there any chance that OU will move in that direction as well?
I would love to, but state law was passed and signed by the governor right at the end of the legislative session that explicitly prohibits in state institutions, colleges, universities, and schools from requiring vaccination as a condition of attendance or admittance. So we cannot mandate vaccine in Oklahoma. The law did exclude healthcare settings. And so we do have a requirement for vaccine if you work on the Health Sciences Center campus and are in any patient contact areas. And that did include some students on the Norman campus, particularly in programs where they actually do have client responsibilities, go out and see patients, see prisoners or others where there is a kind of a provider-client or provider-patient relationship. But the broad question for the Norman campus is that we cannot mandate vaccine. And the governor signed an executive order right after he signed that bill that explicitly keeps us from requiring a mask for unvaccinated individuals, which is one thing that we wanted to do, but we cannot do that now, and I can't control that.
Yeah, that's been the tough one. I think it's been a conversation too about what does that mean for us as individuals and doing our work and maybe even making common sense approaches. So in turn, I know a lot of our conversation now has been how do we continue to incentivize vaccinations or just provide information to the public about that encourages getting the vaccine, understanding the benefits of it and the public health safety benefits of it for sure. The other thing that we have done, and this is more so, this is not fully fleshed out yet, but we are working on finalizing data where we're trying to get perceptions and attitudes around vaccinations, at least with our OU campus community members, particularly our students. And so shout out to Katie Qualls-Fay for helping us out with that. She helped us develop a similar survey around masking and attitudes towards masking. And we were actually pleasantly surprised at the beginning of the school semester about students' willingness to commit to actually paying attention and following the mask mandates that we did put in place at the beginning, despite some disagreement here and there. And we've had relatively good compliance with masking. So we wanted to ask the same questions around vaccinations, and we were able to get responses from, I think, over 3,000 individuals, and among those, nearly 70% said that they've been vaccinated or fully vaccinated amongst our students. Certainly there's some bias in these surveys, obviously, but I also believe strongly that when we think about the level of compliance around masking and attitudes around science, and even some of the ways in which there's been correlative political leanings, I do feel pretty confident that that's a pretty good sample size survey and shows a lot of commitment to actually getting vaccinated for our OU community members. And so that's really good right now. Another question that's popped in here is thoughts. What are your thoughts on those who do not trust nor are interested in getting vaccinated? What would be the message to those individuals?
Well, Scott may be better at this than I am. Just to highlight, there's some individuals are not going to be vaccinated. They just simply are, they're anti-vax. They're not going to do it. I don't try to convince them one way or the other. It turns out that's a relatively small proportion of the population, maybe 15% or so, that just absolutely anti-vax, won't do it, and we just don't waste our time trying to convince them to change their mind on that. A lot of people have misinformation. So and particularly in the college age group, we've seen a lot of young females that have bought into some of the myths that have been out there about fertility, impacts in pregnancy. In fact, multiple studies have been shown now that these vaccines are incredibly safe in pregnancy. And in fact, they confer protection to the infant because the antibodies cross over the placenta and also in the breast milk and confers protection to the infant with no side effects at all. And in fact, as I tell all pregnant women that I counsel about it, you don't want to get COVID. during pregnancy. You do not want to. So young females, particularly college age or childbearing age females, that's been a concern. There's no association with infertility. In fact, many women have gotten pregnant after they've gotten the vaccine, and that's been clearly shown at this point. But I think providing correct information, I think what you will see with the start of the fall semester is we will work very hard to make sure that we get lots of good information out, encourage students to be vaccinated, make sure that we address any myths. I'm happy to meet with any group that wants to talk about it, and then make them readily available. The team over at Goddard done a great job of, you can get a vaccine anytime. We may look at some vaccination events early in the semester just to make sure we try to catch people up. But just encourage, give correct information. Don't be confrontational. It doesn't work. It doesn't help. Just provide good science. And then peer pressure, I think, is useful. Maybe not even peer pressure, but seeing their peers being vaccinated, I think, once they see that, they know they did fine. We'll get more students vaccinated.
Absolutely. Thank you. So we had another question here from the Student Life crew. What are some tips for managers and colleagues to best support our peers, students, or community as we return to campus? Scott, I don't know if you have any thoughts about that.
Yeah, I do. The first word that came to mind is patience with each other. I think about it as none of us are going to be functioning at 100%. And we're likely to have a little bit more of a roller coaster or dolphining in our performance. So I think we need to be patient with each other, and keep our eyes and ears out for our colleagues, students, others we know that just seem to be having a difficult day. That may be, instead of punishing, it may be, hey, do you want to take a quick walk and we can go and just talk a bit, or find ways to engage and figure out what's going on with them. Because I think we need to not just assume what somebody else is going through, but be patient to be there with them and help them and give them the benefit of the doubt that there may be other things on their plate that we're not aware of. So I just think patience has got to be the big thing. Modeling, good behavior and open communication, I think is helpful. I think it's also helpful to also model my door is always open. I'd love to touch base with you. The other thing I've thought about from a managerial perspective is just to have some one-on-ones with people when they start coming back, to just be aware as the manager, what are the things that are on their plate? What are their concerns? How are they doing? So that I get a baseline for where they are coming into this process. And then it can help me to know individually how to help each of them. So that may be some tips I think of to start with.
Yeah, absolutely. One of the big things that I try to actively commit to is asking how are you feeling, but also making sure I don't do it at times when I don't have time to listen. Because how oftentimes we walk past someone and say, hey, how you doing? And that's our way of saying hi. And it's actually really, I don't really care how you're doing. And so like that feels terrible, right? So I do think going through, our time and as we kind of continue to re-engage is be sensitive to that. And the other thing that I find is that, we, as someone, people don't know that I'm actually pretty introverted. Like I'm not a shy introvert, but I'm certainly someone who likes my space and time. And even I'm kind of energized and excited about the idea of, getting to see more people in person and having the campus energy change, but also just recognizing my own energy, because there's times where I've been, feeling exhausted, overwhelmed, especially when we hit graduation season, and it was like about 10 graduation or celebration events that I was at in a week's time. And there were a few moments where I was like, yeah, I was good outdoors, but I'm feeling less confident inside Lloyd Noble Center. So let me just have my mask and I'll throw it on every once in a while, and it makes me feel okay. And even though I'm vaccinated, I know that there's just a certain level of comfort that came with that. And so being sensitive to each other will be really important.
Yeah, and the only thing I would add, especially from a student life perspective, is your hours are bizarro. So if you've got lots of events back to back to back, maybe see that in your schedule and find some downtime. So if you've got some introverts, to give them some time to re-energize after those heavy pushes, being more sensitive to those things may help too.
Absolutely. And let's see, we have one last question here. For people that are not vaccinated that we work with, is it only based on the honor system, or can we find out who has or has not been vaccinated? How can we protect ourselves?
Yeah,
Yeah.
the short answer to can you ask is no. Particularly if you're in any supervisory type of position at all, you cannot ask whether somebody's vaccinated. The attorneys have pretty well decided that. We may confidentially try to capture information on vaccine as part of the registration process or somewhere along the line, just so we have a sense at a campus level of what the rate of vaccination is. But no, you cannot ask the individual their vaccination status. And quite honestly, they can tell you whatever they want, and there's no good way to prove it. We know the CDC cards that you all got when you got your shot are being forged, and you can buy them on the internet. So they're not terribly helpful either. So how do you protect yourself? Number one, again, get vaccinated. Make sure you're vaccinated, fully vaccinated, because that has clearly been shown to be the most effective way to prevent infection. Again, the rates of infection, if you're fully vaccinated, are way below 1%. I think it's in the 0.01% if you look at the CDC data. So it's really low. And then second, if you're not comfortable, wear a mask. Nobody should ever question you on wearing a mask. We know that masks work. They're very, very effective. You know, it's been kind of interesting. My office is here in the Children's Hospital, and we're seeing a big increase now in RSV infections in kids. And we believe that in part it's because all the mask mandates went away. People aren't wearing masks anymore, and kids are getting infected with RSV again. We didn't see any through the winter months when we typically do. So you know, if you're concerned, keep yourself safe, wear a mask, get vaccinated. That's the most important thing.
Absolutely. Thanks, Dale. Yeah, I do recall in the phase 4 information did have some information there that might be helpful too if you have questions about some of the conversations that you can have or cannot have. Definitely supervisors should not be asking supervisees about their status. I know that there's been casual conversation between peer groups about vaccination status that happens oftentimes too. And I know that there's some HR guidance that says, you know, that may occur, but if it occurs in a way that is disruptive to the workplace, that's what we're trying to avoid. And so, yes, you know, what Dale said is absolutely important to note, that you need to be sensitive to that in your conversations, but also do the things that are within your power and control to protect yourselves in your interactions too. All right, so that was the last for questions. We're actually about time as well. So great conversation, great questions from our attendees. I really appreciate you all being here and contributing. If you have a moment while we're getting close to adjourning, I'd love, if you're interested in throwing in the chat, I'd love to hear from y'all. You know, what are you most looking forward to doing or doing more of that you weren't easily able to do early on during the pandemic? And I'd love to maybe even hear if there's any other thoughts about that question from Scott or Dale. For me, I think I'm definitely looking forward to teaching in class. That's one thing I'm definitely looking forward to. The other piece has been being able to spend more time with family. I hadn't seen my parents in Tulsa for over a year until all of us were fully vaccinated. So I'm looking forward to actually visiting with them more often monthly and spending more time with my family. So that's one thing that'll be more easily done, hopefully, as we continue to recover and hopefully thrive from the pandemic. But Scott or Dale, any quick thoughts on that?
I'm looking forward to traveling again. I used to travel very, very often. And I don't even remember the last time I was on a plane or anything. So I'm looking forward to traveling again. And that's something that I've missed a lot.
Yeah, you know, I've got a great window that looks out over the library, quad area, Ellison Hall. I look forward to the traffic of students again. It has been far too empty for far too long. And I used to always, you know, when summer was over and the students come back, there'd always be mixed reactions, excitement they're back, but also missing the summer. This year, I think I'm just going to have just enthusiasm to have that energy back, because even last year it wasn't there. I would see a trickle of students going to class. So I think for me, I just look forward to this place being busy again. think back now, Will and I were on campus last summer, and he and I would take half-hour walks, and maybe we'd see a person. So for me, it's campus being full again, buildings being full, people around laughing, joking, playing music. I think that's what I'm looking forward to.
Yeah, absolutely. Yeah, I had sent a text to Will and actually Amy about the fact that I went to work out for the first time in Sarkeys last week, and it was actually a nice thing to see, you know, folks playing basketball and volleyball. So I'm definitely looking forward to students coming back too. So I wanted to conclude. We've got about 5 more minutes here with next steps. So, well, first, before I conclude, I want to say thank you again, Scott, Dale, for being here with us as our guests and really providing some great information for us to share with others. So next steps, we are working on pulling together highlights of the Phase 4 campus plan document to be sent to our directors and supervisors and our leadership team and student affairs. And so we'll share that with you all to also pass along to your teams soon, that kind of bullets and kind of synopsizes some key points that we think are helpful for you all to be thinking about with the Phase 4 plan. And also the plans leading into August, right, for fully in-person services. And also, I know this will also be an extension of the conversations you've already been having with your supervisors or your AVCs and associate deans. So if you've not been having those conversations about what the plans are now for preparation during the month of June and July, anticipating August, please make sure you're doing that. Make sure also too that you add to your calendars, look at it, that's on your calendar for the Student Affairs Reunion scheduled for Monday, June 21st at the Jimmy Austin Golf Course Pavilion. Our hope is that, you know, if you feel comfortable that you're able to come out and join us. It's an outdoor space for us to kind of gather. I think it'd be great to see you all and get together. We have not had a chance to get together with our division in a long time. And so would love to have you all participate and join us later on this month as well. So, and with that, we are at about time. And unless there's any final thoughts or questions or comments, Scott, Dale, you have anything else you want to offer?
Yeah, my only offering is I hope not to use much Zoom again next year. That's the other thing I've said. That one of the weirdest things for me in the pandemic is that weird Zoom wave when we say goodbye. Somebody once talked about, we never do that at meetings. Like we don't get up from a conference table and wave at each other. So I will be glad to see the Zoom wave go bye-bye. That's my other great thing I'm looking forward to.
Yeah, I went ahead and committed to the Zoom wave, and even though I resisted it for a long time. We did have one quick question in the chat. It was, will you have access to this link for individuals to view at a later time? And yes, we will have access to this recording, and we will share the link out with folks to view again. It's been a great conversation, great time. Thank you again for all the work you all are doing for the university, and thank you to all the attendees. So take care and have a great rest of the day. And also, if you have time, I will not be mad if any of you are just happen to be watching a sporting event at 2 o'clock today during the day. So I hope you all are having a great day. Take care.